I typically focus on medication and on cannabis use and some other topics, but this is a new presentation that we have started giving since about April, because there's just so many different things that are coming up because of this pandemic, and we're getting calls to our poison helpline about all sorts of different health and safety issues. So I'm excited to talk to you all about it today. Perfect. All right. So this is what I'm going to talk about today. I'll give you a little bit of an overview about what the Washington Poison Center is, and then we're just going to dive straight into all of the different things we're hearing about during this pandemic and some things that you can do to make sure that you stay safe. So we'll start with just talking about the Washington Poison Center. So we are one of 55 poison centers in the United States. Every state has a poison center. Some states actually have multiple poison centers. So we serve the entire state of Washington. And we have been here for over 60 years now, and we help with anything that has to do with poisons, which is a super broad category. For us, anything can be a poison if it's used the wrong way, in the wrong amount, or by the wrong person. So you have what you would classically think of as a poison, like chemicals and cleaners and stuff like that. But then also we help folks with craft supplies, with flowers, plants, berries, fumes, vapors, alcohol, drugs, medications, snake bites, insect stings, really anything that can be harmful, we help people with. So we have two primary services. There's public health education, which is my job. So there's 3 of us here in Washington that provide education. And then there is our bread and butter, which is the poison helpline. So if you don't have this phone number saved in your cell phone, I highly encourage you to save it now, just so that you have it ready to go in case you ever need it. So this is a free telephone number, and it's the same number across the entire United States. Call us from anywhere and you're going to be routed to your local poison center. So this phone line, the telephone helpline, it's open 24/7 every day of the year. Our hours have not changed during the pandemic. We are still always available and always ready to help you. It's completely free. We're never going to ask about insurance. And then we are also 100% confidential. Just like going to a doctor's office or going into the hospital, we protect your information. And then if English is not your preferred language, or someone you're helping, not their preferred language, we have interpretation in over 260 languages. So I wanted to share a little bit of our data just so that you can see the volume of calls that we receive. So last year, in 2019, we received over 125,000 calls about more than 66,000 cases. So there's a little bit of a difference between cases and calls, because a lot of times a patient is going to involve multiple calls, because we'll follow up. They'll call back and ask more questions. We want to make sure that everything is going all right and that they are treated fully. Those calls come from all over the place. A lot of times they're from home, from the workplace or school, but we also receive a lot of calls from medics and EMTs who are either on the scene, so someone's called 911 and they've showed up, or they're en route in an ambulance to the emergency room, and they'll call us. About a quarter of our calls are also from healthcare providers, so doctors or nurse practitioners, nurses, who are calling us from an emergency room, from a healthcare facility, and they need extra help with a patient. Unsurprisingly, about half of our calls are about kids younger than 6. If you have ever been around a child, you know that they put everything in their mouths. That is how they explore the world. So it's really unsurprising that we get so many calls about little kids. But we are definitely not just for kids. We receive tons of calls about teens, adults, older adults, and they actually tend to be more serious than calls in the little kiddos, because it might be a medication error or a bigger exposure to a more harmful substance. Alrighty, so what's going on during this pandemic? I pulled out our call data that's specifically for adults that are 60 and older. So this compares 2020 to 2019, and it's the first 6 months of each year. The blue bar is 2020 for each category, the orange bar is 2019. So you'll see that calls in all of these categories have increased this year. More older adults are calling us about medication errors. More older adults are calling us about accidents with non-pharmaceutical substances, etc. So why is that? The biggest reason is that we are all at home all the time now. So we have new daily routines. We aren't going out having the same social interactions, or if people work, they're not going out and working potentially the same way. So all of these new routines have really just thrown our lives into kind of a tailspin that's hopefully leveled out a bit more now, but has made things really unpredictable, has led to a lot of decreased focus, etc. We probably have a lot more cleaning products at home because we're all trying to make sure that we don't end up with COVID-19. Because we have more of these products at home, we have a lot more access to these products, so we're more likely to have an accident with them. It's been pretty stressful the last 6 months. It just keeps on coming. 2020 won't end, and this can lead to a lot less focus. And then there's also tons of rumors and misinformation out there. I swear every day there's something new that's come out on a miracle cure or a new product to try that'll for sure help prevent getting COVID, etc. So there's a lot of rumors that are flying around out there. And these can all lead to us making mistakes or having a harmful exposure to something. So we're going to go through some of the different products that we are concerned about at the Poison Center right now. And we're going to start with household cleaners and disinfectants. So the category of accidental misuse is basically any unintentional accident to a non-pharmaceutical substance, so not a medication. So what all do you think are the top substances that we are getting calls about that people are having accidents with? Just go ahead and unmute yourself and shout it out. Any guesses?
Is it Clorox?
Yeah, that's a good guess. I guess the picture is kind of a obvious clue.
Well, just
probably should have had that animated in later, but yeah, any other guesses? Look at the picture.
Hand sanitizer.
Yeah, that's a big one. Okay, so the number one substance specifically for older adults that we're getting calls about is bleach. So Clorox, stuff like that. Then hydrogen peroxide and any sort of other disinfectant. So why are we seeing this increase? We've already gone through the reasons. Lots of stress and anxiety about COVID and wanting to prevent it. And then there was just, I'm sure you all remember going to the grocery store and there were no cleaning products on the shelves. It's like they were completely wiped out. And so there might have been some just random products we never heard of before that we would just grab because at least it's something to clean with. So that was a lot of us a few months ago. Even nowadays, I feel like it's still really hard to find Clorox wipes. So we're using products that we're not necessarily familiar with. And if we're not reading those instructions closely, we're not super familiar with what to do with the product, then we might end up having an accident with it. Increased use, obviously, the more you're using it, the more likely you are to have a mistake with it. And then those rumors and misinformation. So what are some things you can do to make sure you are safe with cleaning products? Some of these are kind of no-brainer recommendations. But you'd be surprised at how many people don't follow them. So wear gloves, open windows, doors, make sure there's enough ventilation when you're cleaning, and then read and follow all of those directions and safety warnings really closely, especially if you're using a product that you aren't as familiar with. Labels are very, very detailed. They'll tell you everything that you need to know about it. One of the things we hear about a lot that people get mixed up with is concentrated products. They don't realize that a product needs to be diluted, like water added to it. And so they end up using a product that's really, really strong. Stronger does not necessarily mean better or more effective. If anything, it's just going to put you at increased risk of harm from it. So make sure you're reading those directions and following them really, really closely, and then only use products as they are intended to be used. We've heard a lot of people using products for all sorts of different things, like disinfecting their food or using products on their skin that's not meant to be put on skin. And so that can lead to some harmful reactions and can make people pretty sick. Never mix cleaning products. This is a big one that sometimes people don't know about. So when you mix cleaning products, sometimes they can create hazardous gases or toxic gases. So the big culprit with this is bleach and ammonia. Really, if you ever see a product that has bleach or ammonia on the label, never ever mix it with anything unless it's water. But to be safe, just never mix anything. It's always the best route to go. It's not always going to say bleach or ammonia on the label. It might say sodium hypochlorite, that's bleach, or ammonium hydroxide, which would be ammonia. If you're ever unsure about what is safe to do with a cleaning product, you can call us at the Poison Center. It doesn't have to actually be a poisoning that you're calling about. You can just call us for information. We're happy to talk things through with you. If anything, our folks who answer the phone would prefer that you just call for information because hopefully that means they're preventing a mistake or an accident from happening in the future. I mentioned disinfecting food earlier. So we tell folks to never ever use cleaning products on food. There is really no evidence or very limited evidence that COVID is transmitted via food. So to keep yourself safe, instead of using these harmful cleaning products on what you're going to be eating, we tell people to just, when you get home from the grocery store or home from picking up takeout, wash your hands, wash any produce you've bought with water. You don't need to use bleach or any other chemical on it. And then before you eat, just wash your hands again. And that is sufficient in keeping you safe. Then with masks, we have received lots of calls from people who have been spraying or soaking their masks in disinfectants or cleaning products. And when they do that, when that mask is put back on your face, you can inhale fumes from those cleaners and disinfectants. And then you can also get the product on your skin and it can cause a skin reaction. So really all you need to do with masks is wash them with soap and water. You can throw them in the dryer for some added disinfecting with heat, but you don't need to spray or soak them with any sort of cleaning product. Safe storage is really important. So this slide is a very classic Poison Center slide with all of our look-alike products. So things that look like they're safe, but they aren't actually safe. So you would have no idea the number of calls we get, especially with this Gatorade and Lysol bottle example, where say someone has a product that's concentrated, they need to dilute it a little bit, so they put it in a container, dilute it down, they have some leftover, so they just throw it in a Gatorade bottle. Well, the Gatorade looks the same as the cleaning product, and so then someone else in the household or later on might take a swig out of that Gatorade bottle, and it's actually a cleaner. So we recommend that you always store your products in their original containers and then label those somehow. We have Mr. Yuck stickers at the Poison Center. If you're not familiar with Mr. Yuck, he's this little green dude that's making a face, and it has our phone number on it. But it doesn't have to be Mr. Yuck. you can label it with anything that's really easily identifiable. So tape, other stickers, you can take markers and color the caps in or write on the labels. And then always store those products up high and out of reach of young kids who, as we talked about earlier, just love to explore and take a taste of everything. As always, give us a call if you have any questions about cleaning products, if you feel sick after using a cleaning product, or if you have an accident with them. Are there any questions so far? Nope. Okay, so we'll talk briefly about hand sanitizer, which was, I think, Candace, you said hand sanitizer earlier.
Yep.
So yeah, so we always get calls about hand sanitizer. It's always been a big one, especially the little bottles that you can clip onto purses or backpacks that have the fun scents. Lots of kids like those. So we get a lot of calls about them. So the concern with hand sanitizer is that in order for it to be effective, it has to have a lot of alcohol in it. So when a kid then takes a sip out of a hand sanitizer bottle, they are drinking a lot of alcohol and they can end up with poisoning from that alcohol. And during this pandemic, we have seen a huge increase in kids getting into hand sanitizer, a 41% increase. It's big. And a lot of that is because of these mix-ups with hand sanitizers. So I have a lot going on the slide, but the picture in the upper left says that it's edible. Don't know why it says it's edible. Hand sanitizer is never edible. The one next to it, it looks like a water bottle, like a little sports water bottle. The image below that is hand sanitizer with a dosing cup on it. Makes no sense because hand sanitizer does not need to be dosed. So it looks like it would be some sort of medication. And then the image on the right-hand side looks like those little sauce, like applesauce and veggie packs that kids eat, but it's actually hand sanitizer. So because of these really look-alike substances, look-alike hand sanitizers, kids are more prone to have accidents with hand sanitizers. So if you're using hand sanitizer around kids, make sure you're supervising them. Use just a really small amount, like the size of a dime, and have the kids rub their hands together until they're completely dry. That way they don't take a lick out of it or get it in their eyes. Keep all of those bottles out of sight, out of reach when they're not in use. If a child does get into hand sanitizer, give us a call immediately. Don't wait for any symptoms to arise, just call us right away. And then just to make sure you all are aware, there is a very, very large FDA recall list for a bunch of different hand sanitizers now. So some of them are contaminated with methanol, which is a different kind of alcohol that's actually very toxic. It's most concerning if it's swallowed, but it can also cause some problems when it's put on your skin. And these contaminated hand sanitizers were being sold all over the place. Costco had them, the dollar store, all sorts of different name brand stores had them. So check this list to see if your product that you have is on there. If it is, throw it away. There's also on the list a bunch of hand sanitizers that are sub-potent. So they don't have enough alcohol in them to actually be effective. So essentially there's no point in using them because they're not going to kill all of the germs that you need them to. So check that list, give us a call if you have any questions or if you're worried that you've been using one of the products on there.
How much alcohol should be in there?
It should be at least 60%.
Oh, okay.
Yep. Alrighty, so we'll move on to medications. So we've, here we go. Sorry, moving you guys so I can actually see what I'm talking about. So medications, they've always been a big thing that we get calls about because medication errors are so easy to make. So what I mean by medication errors is any of these 5 wrongs. So the wrong dose, you accidentally take your medications twice, or you take 3 pills when you were only supposed to take 2. the wrong medicine. You accidentally took NyQuil instead of Pepto-Bismol. The wrong person, you took your spouse's medication or even your pet's medication. The wrong time, you took your morning pills at night, and the wrong way. You accidentally swallowed something that should just be put on your skin. So these are all very, very common. We receive hundreds and hundreds of calls in all different age groups about them. For older adults though, so adults 16 up, what do you think are the top medication errors that we hear about? You can unmute yourself. Oops. All right. As I just showed you the answer.
I think is forgetting that you'd taken it before. So you take it again.
Yeah, so some sort of wrong dose. Yep. Any other guesses? Well, yeah, so wrong dose is the number one. Lots of double dosing specifically, but then taking the wrong medication. A lot of times that might be because you've kept leftover medications, so expired or unneeded medications, and then the wrong person. So these have always been a top concern for really every age group. And then during COVID, we've just seen a bigger increase in medication errors because of those new daily routines. So if you were someone who relied on memory cues beforehand, so for example, you always took your pills as you were grabbing your coffee to walk out the door. Well, if you're not going anywhere now, you don't have that cue to take your pills. So you might miss that dose. You might not remember if you've already taken it, double dose it. Stress and distractions as well can lead you to grabbing the wrong medication or taking it more than once. And then if you or someone that you know relies on some external support, so a caregiver or family member, kids coming over helping with medication, you might not have that same level of support available now that we need to be so physically distant from each other. So some easy poison prevention for medications is to always keep medications in containers. That can be either the pill bottles that they come in or a pill box. When medications are loose, it can be really easy to not remember what they are, to take them at the wrong time, etc. Keep medications separate from those of other household members. That's not always possible to keep medications in separate cupboards, drawers, etc. So you can use labeling. This slide shows colored bands on the bottle. So one person could have all blue, the other person could have all yellow. Doesn't need to be this fancy though. You can use a marker, color the caps. You can use stickers, really anything that's very easily identifiable. And then store those medications out of sight and out of reach of kids. Read medication labels closely, just like those cleaning products. There's going to be a lot of detail on there of important things like timing and a maximum dose if you're not supposed to take more than a certain amount within 24 hours. And then really, really check ingredients. This is especially important with over-the-counter medications. A big culprit is acetaminophen. So acetaminophen is Tylenol. It's in a ton of different medications. It's just by itself. It's in a lot of cold, cough, and flu medications. So you want to make sure that you're reading the label to make sure that you aren't taking two products that have overlapping ingredients, the same ingredients, because that can be very easy to do, especially with things like acetaminophen. Then use some physical tracking systems to replace those memory cues and to make sure that you're not taking the wrong dose. That can be a medication checklist like this, where you would write out the name and then just check it off after you've taken it. You can use a wall calendar, a phone calendar. There's tons of cell phone apps. This one is called MediSafe and it's free. It's pretty easy to use. I actually use it myself. And then there can be pill organizers as well. And then use a medication list too, to ensure that you know everything that you're taking, and this is something good to then also take with you to any healthcare provider appointments to verify that you have all of the correct information, everything that you're taking is necessary. A good medication list is going to include all of your prescription medications, any over-the-counter meds that you regularly take, vitamins, supplements, and any other substance that you use. So for example, if you use CBD cream for something or CBD pills for something, that needs to go in the medication list. And for each substance, the name, dose, why you take it, the time of day you take it, and any special instructions like this should be taken with water or with food, things like that. Don't hang on to meds. Leftover medications can be blamed a lot of the time for taking the wrong medication or the wrong person taking the medication. So leftover meds are anything that are expired, unneeded, unwanted. A lot of times people don't know what to do with them, or they think they might need them later on, so they hold on to them. But it can really put you and others at risk of some medication errors. So Washington has a great system where we have secure medicine return locations all over the state. And there are tons here in the Seattle and King County area. This website, takebackyourmeds.org, it has a map, which is what this image is, but then there's also a search function where it just lists out cities and locations. And it shows you where all of these medicine return boxes are located. So you can look those up. It'll tell you if there's any restrictions on what they'll accept. It's a pretty slick process. They're always going to be free. They don't charge for you to take medications back. Obviously, since we're in a pandemic, don't make an extra trip if you don't need to. Our recommendation is if you're already headed to a pharmacy for something or already headed to that location for some reason, take the medications back. Otherwise, just safely store them until the next time you need to go there. More lookalikes. So just make sure that you're distinguishing things that look alike. A really, really common call we receive is people putting eardrops in their eyes or glue in their eyes because those bottles look exactly the same. So use Mystery X stickers, color the caps, use some form of labeling. And give us a call if you ever have any questions. So obviously, we want to make sure that you don't have any sort of poison exposure, but mistakes happen, accidents happen all the time. So I just want to make sure that you are comfortable in knowing what it's like to call us. So again, it doesn't have to be an emergency. You can call us for information as well. The great thing about our poison helpline is that we're always open, so you're always going to get a hold of someone immediately. You're not going to have to go to the emergency room unless it's absolutely necessary. So you're preventing some further COVID exposure. You're saving money because we're free. And then also we're keeping 911 open for folks who are having bigger emergencies. So when you call us, you're going to talk to one of our specialists in poison information. So these are all nurses or pharmacists who have gone through a ridiculous amount of training. Our staff, they average about 13 years in our call center. So they have a lot of experience in taking these calls and helping people with all sorts of different substances. If they ever need any help, we also have on-call board-certified medical toxicologists that are available around the clock. So these are MDs, doctors who have specialized in toxicology. They will guide you through a series of questions. They're going to ask you what was taken, how long ago, how much, how are you, or how is that person feeling? If you don't know the answers to all of these questions, that's totally fine. They just want to get as much information as possible. And then they will tell you what to do. Hopefully, you can stay at home. If that's the case, they'll tell you exactly what to do, what to watch for. If there are any symptoms, to call back. They'll also call you back. Most of the time, this is what we can do. So far in 2020, we've kept over 90% of adults 60 and up at home. So that has been great. But sometimes you do have to go to the emergency room, and we will tell you that. We'll tell you if you can drive, if you need to call for an ambulance, and then we will call ahead to the emergency room to let them know you're coming and what the treatment should be. And then a lot of the times, we'll call you back afterwards. sometimes multiple times, just to make sure that you're feeling okay, everything's going all right. You can ask more questions. You can call us back again. Last time, here is our phone number. So if it's not saved already, save it now and give us a call anytime. All right, that was all the information I had. So I'm happy to answer any questions.